Hello friends, welcome back to my YouTube channel, The Ocean of Medical Literature. In that video, we will see about the wall of hearts. Okay, as we know, what is a wall? Wall, it is a structure which is present in the heart. Okay, which is means it's preventing the backflow, unconditional flow. Okay, if supposed to be, if anything is liquid structure is passing from inside any tube. So here is the one wall which is present, means closure type structure is present, which is prevent the backflow. Okay, if going it's from upward to downward, so it should not be go back. So that's why here is some wall like structure is present to stop that unconditional flow. Okay, so in the heart also, here in the heart, that is a arteries and vein and some chambers. So in that, when the blood is pumped and passing from that vessels or chambers, so that time to prevent that unconditional flow, there is the wall which present. Okay, it is very simple topic, students. So we will see the wall. Okay, in the heart there is mainly two types of the wall. Okay, we will see one by one. So students, what are the difference between aortic wall, atrioventricular wall and semilunar wall? So if you see in the heart structure, there is the atrioventricular septum between the two upper atria and two lower ventricle. That septum, due to that septum, this valve is called as the atrioventricular wall. Why? Because in the, if you see in the right side, okay, between the right atrium and the right ventricle, there is a wall. That wall is called as the tricuspid wall. Okay, why it is called as a tricuspid? Because there is a three cup like structure, three flaps is present like that, 1 2 3. That's why it is called as a tricuspid wall. Okay, that is the atrioventricular wall. Under the atrioventricular wall there is a tricuspid wall first. Okay, I'm just first point, tricuspid. Okay, and if you go to the left side, okay, if you go to the left side, that is the between the left atrium and the left ventricle, there is a wall which is present called as a bicuspid, because that's only two flaps. Okay, only two cups like structure is which is the also known as a mitral wall. Okay, so that's why it is called as a bicuspid. Okay, bi means two, tri means three, cuspid wall. Okay, so that is only the difference. That is a tricuspid and bicuspid, which is only present in the atrioventricular septum. That's why it is called as the atrioventricular wall. Okay, the second point is the semilunar wall. Semilunar wall is present. Okay, if you see in the right ventricle. Okay, first we will see the right ventricle. In the right ventricle, when the right ventricle pumps the blood for purification of the blood to the lungs through pulmonary trunk, so that flow of the blood, to prevent that flow, there is the pulmonary semilunar valve is present. Okay, what is that? Pulmonary semilunar valve. Okay, and if you go to the left side, in the left ventricle, there is, when the left ventricle pumps the oxygenated blood to the aorta, so there is only the valve which is present, that is called as the aortic semilunar valve. Aortic semilunar valve. Okay, so these are the valve. Okay, these valves are, there is a difference between say atrioventricular valve and semilunar valve. Okay, this structure, there is a difference between these valve. Okay, but what exactly containing the valve? Okay, what structure under the valve? Okay, so pay attention here. It is the aortic sinus. Why? What is a sinus? Sinus means when two blood vessels is joining at that point, there is a something dilation is formed. Okay, and that dilation, there is a valve-like structure is present. That's called as a valve. Okay, if you see here, there is a three cups. These three cups prevent the backflow. That is called as a valve of the vessel or blood vessel wall. Okay, these three cups, see aortic sinus, right and left coronary artery present between the two each cups. Okay, then nodule and lunule. Okay, this part. Okay, so from which part this curve is formed. We will see one by one. Okay, student. What are the structure? Means due to what structure the valve is made. Okay, so this four structure is are responsible to make the valve. Okay, first is a fibrous ring. Okay, due to the fibrous cartilages, there is a fibrous ring-like structure is formed, which is attached to the valve. Okay, vessels of the surrounding that tissue. Okay, so that is a fibrous ring. Okay, fibrous structure is present. Then next is a cup. Cup, it is the like the cup. Okay, if you see, this is a moon, half moon like structure, that is a cup. So cups are present in the semilunar valve. There is a 3 or 2 cups are present, but sorry, if you see in the atrioventricular valve, so in the atrioventricular valve, there is right side only 3 cups are present, and left side there is a 2 cups are present. But if you see in the semilunar valve, there is not like that. In the semilunar valve, only there is a 3 cups are must present. Okay, there is no 2 cups or 1 cup. There is only the 3 cups are present. So that is the cup. So the cups are attached to the fibrous ring. Okay, so cups are attached to the fibrous ring, and if you see, the cups are going downward in the ventricle. Okay, if you see, it's the projection of that cups are going to the downward. So that is it is going to the ventricular cavity, not to the atrium cavity. So its fibrous structure, sorry, its cup structure is going downward. Its projection is downwards. Okay, so that is a cup. Second word is the cordia tendini. Already told you in the last video what is the cordia tendini. That is a thread-like structure which is attached to the cups of the valve, and it is second end of the cordia tendini. It's attached to the muscles. So what are the function of the cordia tendini? Cordia tendini, it's allow movement to open the valve and close the valve. Okay, that is the cordia tendini main function. Then the last one is the papillary muscles. Okay, papillary muscles we already see in the which is present in the ventricular cavity. Okay, inside the ventricles wall there is a papillary muscles. So second end of the cordia tendini is attached to the papillary muscles. Okay, when the cups are open, blood is pumped into the ventricles. Then the papillary muscles act, and the cordia tendini regain the position of the cups. Okay, so that is the main function of the cordia tendini and the papillary muscle. Okay, if this function is failed, so closure of the valve is not proper, and there is a backflow of the blood is seen in the body, and that time there is a medical condition occur in the valve. Okay, that time the valve replacement surgery is done by the cardio surgeon. Okay, so that is the main function in the cordia tendini and the papillary muscles and cups and the fibrous ring. These four structure form the valve of the heart. Okay, so that is the four points you have to write if it asks in the examination. So what is the valve description? It is prevent the backflow of the blood. Okay, which is present in the vessels and the chambers. Okay, then you have to describe the two valve. Have a two types. One is the atrioventricular valve. Second is the semilunar valve. Where the atrioventricular valve is present between two upper atria and two lower ventricle. Okay, there is a atrioventricular septum. So that septum, due to that septum, that is called the atrioventricular valve. Okay, and semilunar valve is where is present to prevent the backflow of the blood in the pulmonary trunk and pulmonary artery. Okay, and in the left side to prevent the backflow of the blood from aorta. So there is a semilunar valve is present. Okay, then you have to draw the structure. Then you have to mention these 4 points due to what structure, what material this valve is formed. Okay, so fibrous ring, cups, cordia tendini, and papillary muscles. These 4 structure form together the valve of the heart valve. Okay, so this is a very simple topic, student. Valve of the heart. Then blood supply, arterial supply, venous supply, lymphatic drainage, and nerve supply we will see in the next lecture. So I hope you like the video, you understand the topic. So please like, subscribe, and follow me on Instagram. Thank you.